All right, here we go. Hello, everyone, and thank you for watching this webinar on how to create a billing policy manual. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. This presentation is for educational purposes. It's not intended to substitute any of your thorough clinical decision making. It's not intended to be legal advice. Target coding does not engage in providing legal services, and every attempt has been made to make certain the information in this presentation is 100% accurate. However, it's not guaranteed. A little bit about myself before we get going. For those of you that do not know me, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for many years, 16 years, and about 12 years ago I started a company called Target Coding. I'm a certified professional compliance officer, certified billing and coding specialist. And, I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So I take my experience being in the trenches, being in practice, combine that with my with my coding expertise, and it allows me to challenge my clients, get them to become better at what they're doing, help more patients. I've also written many books and training manuals on chiropractic billing, coding, and documentation. I also have written manuals for physical therapists and acupuncturists. I write articles for the major publications in our profession, like Chiropractic Economics, Dynamic Chiropractic, The American Chiropractor, and I also write articles for many state association newsletters throughout the country, and I'm a guest speaker at many state association conferences nationwide. So those of you that are part of your state association, looking for a speaker, let us know. Our calendar is pretty full for the next 12 months, but let us know if your state association is looking for a speaker on compliance as it relates to billing, coding, documentation, Medicare, HIPAA. So my first question to you, which is probably your question to me, is why do we even need a billing manual? More work, right? Well, I'll give you a few reasons why it's a good idea to have a billing and coding manual. First of all, for your staff. Your staff want organization. Your staff wants leadership. Your staff wants to work in an ethical and trustworthy atmosphere. A billing and coding manual creates that culture of compliance. It explains to them exactly what is supposed to be happening in this office. Plus, it could defend you just in case a staff member is accusing the business owner of wrongdoing. A policy manual can contain the ammunition to defend any alleged misconduct. It's also good for the doctor. It gives you an opportunity to explain what you do and why you do it, just in case somebody comes snooping around. And I'm not only talking about insurance companies. There's other people that could snoop around. There are other organizations and individuals that could ask for your records, like in a malpractice case or a state board situation. So you want to be able to put together a billing policy that explains what you do and why you do it. For example, patient comes in just with neck pain. I mean, I did this. Many of my clients do this. Patient comes in just with neck pain. That's it. You may check the thoracics and adjust the thoracics. You may adjust the lumbars, even though there's no pain, no discomfort. And you're doing, let's say, a full spine adjustment, but you're only billing 98940. There are some auditors that will look at it and go, why is this doctor downcoding? Why this seems unusual? So you get to tell your story in a billing manual. And it's good for insurance companies, malpractice cases, or state boards. Again, people come snooping around. It could prevent audits. And if audited, it could mitigate fines and penalties. I'm going to share a few stories today about how putting together a policy manual has saved a few of the doctors I'm working with hundreds of thousands of dollars because they had a billing policy manual. All right, so let's just cut to the chase, right? That's what you want to hear. We don't want to waste time. So these are the three things that you need to do. These are the three essentials of a billing and coding policy manual. Now, a billing and coding policy manual will be different if you see a lot of, let's say, Cigna patients and you don't see any Medicare patients. Your policy manual, if you see Medicare patients, it's going to look different than if you do not see Medicare patients. So, for example, you may be a doctor that doesn't see Medicare patients. So you're going to create you're going to do these three essentials. If you see Medicare patients, then there are additional things that need to be done. That's basically where you could draw a line in the sand. If you are seeing Medicare patients, you need to do a little bit more than these three things. But if you're a provider that you want to create a billing policy manual because you want to be proactive, because you know it's a good thing to do, it'll help you sleep better at night, just these are the three things. So there are some policies, I'll show you later, there are some policies that you don't have to take any action. I call them, just in case policies. It's like a fire extinguisher. It's good to have one, but hopefully you'll never, ever use it. You're going to buy a fire extinguisher, pay money to have this fire extinguisher in your home or office, and you're hoping you never have to use it. There are certain things in policy manuals that you're going to have, you should have, but hopefully you'll never have to use, like a patient files a complaint against you because of your billing and coding. There's a formal way to document this and handle it to prevent this from becoming a big deal, but that's something you hope you never have to do. So there are certain policies that you don't have to take any action, just understand them, and then there are certain policies where you have to take action. So the one that you need to take action on is creating, doing record reviews. Policy 1.1. Here's an example, a policy. You could pretty much copy this and put this one right into your policy manual. So I'm giving you actual policies. This is a policy taken right out of a target coding policy manual that we do for doctors all over the country. And it's about patient. This is the most important one out of all of them. Policy. The backbone of any compliance manual is reviewing and monitoring components. Without them, we would not know if we were being successful in our best efforts to be compliant. Therefore, our policy will be to perform periodic patient record reviews. That's your policy. What's your procedure? Here we go. The record reviews will consist of blank number of charts every blank number of months, and we'll focus on, here's where we're going to customize this for you. If you see Medicare patients, we'll leave Medicare in the first line. If you do not, let's say I have a client collected $300,000 last year from Aetna. Just from Aetna, collected $300,000 last year. So we focus this on the correct use of the Aetna chiropractic guidelines. See, I customize it, so you should customize this policy for your practice. But the basics here, just leave. If any other significant issues are identified, it may be necessary to develop additional procedures to track and make improvements. And how do you do record reviews? If you've never done them, it's like driving your car, 100,000 miles and never checking the oil. That could be a problem. Maybe the oil light on your dashboard is broken, right? And it's not flashing. So, being proactive is don't wait for the oil light to flash. Get out of the car and check the oil. So that's what this is. So how do you get out of the car and check the oil on your notes? If you've never done it, you're probably going, I don't know. I've never done that. I think my notes are good. I've submitted them in the past. When I submit my PI cases, I submit my notes, they pay, so they must be good. If that's what you're thinking, I don't know how to do this, then here's the answer. Create a chart review spreadsheet. It's just basically a whole bunch of yes or no questions. For example, did you sign the notes? Yes or no. Is the patient's name and date on the notes? Yes or no. Did you write down the subjective, the objective, the assessment, the plan? Yes or no. If it's a Medicare patient, did you list the subluxation level specifically? Yes or no. If this is a regular insurance patient, did you write down when the next re-exam is going to be done? Did you write down when you want the patient to come back? So it's a whole bunch of yes and no questions. And then you score yourself. It's an open book test and you score yourself, and you do these twice a year. A few of these twice a year. Well worth it being proactive. Every doctor that I've dealt with that has been in an audit where they're being asked for money back, And I have clients right now I have some clients that are being asked back for $500, and I have some clients that are being asked back for $1.7 million. So there's a wide range. And every one of these doctors that I speak to that is being asked for money back, they all say the same thing. I wish I would have been proactive. I wish I would have done some more things so this didn't happen. And so what should have they done? What I'm telling you now. Here's another example. You could copy this and put this right into your policy manual. On training, what's the deal on training? When I talk to doctors, they go, oh yeah, I have staff meetings all the time. Okay, so do you write them down? Like, what do you talk about? What is like in the content? So 3 hours per year is what we recommend. And here again, another little spreadsheet, keeping track of it. Somebody comes knocking on your door. Do you do staff trainings? If you go, yeah, well, could we see your logs, your training logs, and you don't have anything, then, verbal, yes, we do staff trainings is not enough. Here's another one that if you see Medicare patients, you're supposed to go to the OIG exclusions list to see if you're excluded from the Medicare program. Now, a lot of you are saying, I've never heard this. I have a compliance consultant. They've never told me this. I don't know why. We teach this all the time at all our seminars. I don't know why your compliance consultant doesn't know this. This is mandatory. You need to go to the exclusions list and check to see if you've been excluded from the Medicare program. This is mandatory. And then this is sometimes what we hear. Dr. Kotler, I only see like 3 Medicare patients a year, or, I'm non-par, or, I don't even know. We just charge the Medicare patients cash. And we hear that all the time. Even if you see one Medicare patient, you're supposed to go to the exclusions list and see you've been excluded. Now, it's not only for doctors. If you have a billing manager that handles Medicare billing and coding, that's part of a compliance manual. If it relates to Medicare, you have to go to this exclusions list. So if you want to hire Douglas Godfrey here as an associate chiropractor or your billing manager, you wouldn't be able to. He's excluded. This is the actual photo of the website. So that's part of compliance. It's part of putting together a compliance manual. Now, some of you that are not being audited, a lot of you listening to this are not being audited. So you're listening to this going, that's a good thing to do. Yeah, we should probably do it. And you may not ever do it. If you are in an audit right now, you are going to want to do this today. If you got a letter today saying, dear doctor, we would like to see records, or we checked your records and they're not good and we want money back, you should be immediately putting together a compliance manual so you could show that you are making good faith attempts to do the right thing. It will automatically make you look like a good guy to the insurance company, state board, or investigator. So background checks, do you need to do them? Yeah, I think it's a good idea. If anybody coming in looking for a job, I would contact their references. I would check their social media pages. You don't have to do it. The only one you have to do if you see Medicare patients is number 6 on the list. And if you don't, you could have problems. Here, I'm going to share some issues that have occurred. I'm going to share these horror stories with you. So this is a chiropractic office that had to pay a fine because this practice was employing an employee that was excluded from treating any federally health program patients. It's not fun. You get a letter like that. So the OIG, the mission of the OIG, Office of Inspector General, is to protect federally funded programs like Medicare and Medicaid from criminals that are trying to rip off the system. And you hear about it all the time. There was just one just this past week. It was called Operation Back Brace, where there were criminals all over the country. I think it was a $2 billion, that's with a B as in boy, $2 billion scam, getting people, Medicare patients, to for back braces and knee braces and diabetic supplies, just automatically being on auto ship to patients. So the OIG takes those things very seriously. As far as chiropractic goes, we've had a couple of reports that, from an optics, viewpoint, and this don't look good. This was a couple of years ago. Hundreds of millions in Medicare payments for chiropractic services did not comply with Medicare requirements. So Medicare and OIG wants doctors to be proactive, having written policies and procedures, putting together a billing policy manual. Now, if you see Medicare patients, besides the 3 essentials that I mentioned to you, there were 4 other things. These are the 7 essentials that the OIG says any provider seeing a federally funded patient should be putting together one of these billing and coding policy manuals. Now, the one we provide to doctors has 18 policies and procedures. And as I mentioned, some of them you just need to read and understand. And others, you need to take action. So out of these 18, probably 3 you need to take action. The other 15, you just need to read and understand. For example, what's your policy on copays and deductibles? Do you waive them routinely? Like, what's your policy? You should have a policy on deductibles and copays and coinsurance. Those of you that are new, we have a lot of people on the line this morning, and some of you may be brand new to chiropractic billing and coding. So a deductible is the amount that the patient has to pay prior to the insurance kicking in. Coinsurance is typically for out-of-network providers. It's a percentage of the allowed amount. And a copay is a flat fee that's usually applies to in-network providers. Routine waiver of deductibles and copays and coinsurance is illegal. It's inappropriate because it results in a false claim. And this false claim results in a violation of the Anti-Kickback statute. You may have heard of that. AKS, Anti-Kickback statute. So here's a couple of horror stories. This doctor got off pretty easily because he got a letter stating that we're contacting you to educate you and inform you that our office received a complaint alleging that you knowingly process Medicare claims as if the patient is paying their copays, but they're not. So that's not a fun letter to get. Here, this is a non-Medicare patient. This is a doc I know, sees a lot of Cigna patients. He's gotten, this doctor I've been working with for a while. I think he collected about $500,000 last year just from Cigna. So they like to ask him for records. Now, typically, they just ask for records, and he typically passes the audits. This one was different. They said, we want to see the records, the notes, the documentation, but it says here, the third bullet down, we also want to see copies of the patient's billing and collection ledgers, documents that show when bills were sent to the patient and how much money has been paid by the patient. So if you're a provider that's routinely waiving copays, deductibles, coinsurance, and you get a letter like this, you're going to be really nervous. You're going to probably have to get a lawyer. Here's another horror story. Doctor sent me this letter. It says, Dear Doctor, after contacting some of your patients, it has come to our attention that you routinely waive all patient responsibilities, coinsurance, deductibles. Another one, please provide us with copies of proof that you collected copays and deductibles. Don't mess around with copays and deductibles. Collect them. Make an attempt to collect them now. If you're in a situation where you have a lot of competition and you need to waive a copay or deductible here and there, it's okay. What did I just say? What did the compliance guru say? It's okay to waive deductibles and copays? Yes, sparingly, not routinely. That's the key. You cannot routinely waive copays and deductibles like all my teachers, I waive copays. All the firemen, I waive the copay. All the patients, I waive the copay. You see, that's routine. Can't do that. But you have a fireman or a teacher that comes in and says, I'm having some financial stress lately. You could work out a deal. So if you're looking for ways to learn how to waive copays and deductibles the compliant way, then contact us after this webinar and set up a free consultation, and we'll show you how to do it. A little bit about Stark and Anti-Kickback. If you own a chiropractic practice and you decide you and your uncle are going to open up another practice, and provide designated health services, you may be violating the Stark Law, so check with an attorney on that. Anti-kickback statute, yeah, waiving copays and deductibles that results in a false claim, that's considered a violation of the anti-kickback statute. Or you get approached by a body shop owner. It says, yeah, we get probably about 100 patients a month coming to our office that have been in car crashes. I'm going to refer them to you, but you got to pay me $300 a patient. That's also considered a violation of the anti-kickback statute. But there are certain safe harbors. When I tell you a certain law, there are creative ways of getting around it. You know that, right? Just like with taxes, there are creative legal ways to get around paying taxes. Nothing fishy here. There are legal compliant ways to get around the anti-kickback statute, the Stark Law, waiving copays and deductibles. There are ways around it in a compliant fashion. So if you want to learn more about it, let us know. Same thing with a discount. Time of service discount, administrative fee discount, prompt pay discount. It all means the same thing. The patient, you're going to give the patient a discount. So, Mrs. Jones, my normal fee is $100. Now, you don't have insurance, or you have a huge deductible, so we'd like to give you a discount. So my question to you is, how much can you discount? Have you ever looked into it? Have you ever checked with your state board? Have you ever checked with your coding consultant? Have you ever checked with an attorney? How much can you discount? Your normal fee for an exam is $100. Here comes a patient. No insurance or a huge deductible. Can you discount 10%, 20%, 50%, 60%, 80%? How much? Do you know? Do you offer If you don't offer discounts, then don't even listen to this. I'm proud of you. If you don't offer discounts, don't pay attention to this section. But if any of you do offer discounts, how much can you discount? This is what tell you, we work with hundreds of doctors over 25 states. Most doctors that give discounts, they've just made it up on their own. Just talking to a doctor yesterday. Doc, so tell me about your cash plans. Just became a new client. Oh, we offer a 50% discount to all our cash patients and our Medicare patients. We offer a 50% discount across the board. I said, oh, okay. Did you check with anybody on that? Well, I heard it's okay. I heard this. Somebody told me that. No, you don't have anything in writing? No, I don't have anything in writing. I heard this. I heard that. Wow. Dangerous to just go, oh, I have another doctor I was talking to. It's like, well, when patients come in with insurance, we cap what they pay. We just tell them, give us $25, even though the doctor's in network, out of network, the doctor doesn't even know. It's like, you give us $25, and whatever the insurance pays us, that'll be fine. So I asked the doctor, where did you hear that? Who taught you that? Where did that come from? Just pay $25 and everything will be fine. Doctor goes, I don't know. A few of my friends do it. So my question, how much? Mrs. Jones, my normal fee is $100. You don't have insurance or you have a huge deductible, we'd like to give you a discount. How much? Have you checked your state board? Well, I've checked. I checked with one source, the OIG, that's what we're talking about right here, billing and coding policy manuals. They say 15%. 15%. Are you offering more than 15% to your Medicare patients? You shouldn't. Well, Dr. Kotler, well, what about Blue Cross Blue Shield patients and Aetna patients and Cigna patients? Could I offer them more than 15%? Contact me directly, because I have a list of about 30 states that I've contacted the state boards. I've contacted state attorneys to find out the answers to the clients that I have, to the states that I have clients in. So how much could you discount? Federally funded patients, 15%. All others, check with the insurance company. You might not want to poke the bear, but check with your state board. or check with us. Next, what about Dr. Kotler? I want to give away a free exam. Patients come in, I want to do a free exam. Is that okay? Or I just, I'm having a raffle in my office. I was in one of my clients' offices. I just surprised him. I showed up in his office about a year ago, and in his waiting room, he has a mountain bike hanging from the ceiling, and he has a little contest going on. And the patient that refers the most patients is going to win this mountain bike. The value of the mountain bike was $1,800. It's a beautiful bike. Okay, so can you do that? My client asked me, say, Marty, hey, you see the bike in the waiting room? Could I do that? Could I? Well, depends. Is this a cash patient? Is it a Medicare patient? Who's winning this bike? So have you asked your state board? Have you asked around? Do you offer free exams, free x-rays? I know one doctor, he advertises free exam, free x-rays. The first 3 adjustments are free, plus you get a free chicken dinner. Yeah, you go to his office, you get a coupon for a chicken dinner to the local restaurant. Is that okay? So, here's the answer. According to the OIG, federal government, $15 each time, $75 total for the year. So Mrs. Jones comes in. Mr. Jones, I want to thank you for referring a patient. This is a Medicare patient. Here's a $15 gift card to Starbucks, or here's a water bottle or a T-shirt. So could I give away this $1,800 bike to a Medicare patient for referring other patients? No. You shouldn't be giving away anything for free, pretty much, in my opinion. But there are ways around it. You see, that's the key. I'm educating you that, in general, do not give anything away for free. Now, you might go, wait a second, Marty. We would do this, we do that. Yeah, contact me. Let's talk about it. We use ZocDoc, and we use this, and we use Groupon, and contact us. We got that all figured out. Call us. 15-minute consultations are always free. You want to give away free stim? Uh-oh, do not. This doctor got fined. He was giving away free stim to Medicare patients, so they fined him. They said, you violated the anti-kickback statute. It says the doctor has agreed to pay $79,919 to resolve allegations he violated the False Claims Act by improperly billing Medicare for chiropractic adjustments after providing free electrical stim to patients to influence those patients to receive chiropractic adjustments. Whoa. Yeah, I know. Those of you looking at this for the first time are going, whoa, wow, what is this? That's ridiculous. I can't, these are the responses we hear. That's ridiculous. I can't give away free stim to my patients. I can't give them a free mountain bike. I can't give them a free TV. I can't do this. Maybe, maybe not. Forms, right? Also, new patients come in, as far as compliance go, creating a compliance manual. You're going to need some forms, even if you have the best software in the world. There's a lot of really good software programs out there. Genesis, ACOM, Medic Fusion, Eclipse. Excellent software programs. I don't care which one you have. You still need some forms. How many forms? I think I've created about 500 forms. It's one of my favorite things to do, believe it or not, is create forms. I've probably created about 500 forms over the last 12 years. I've put together 75 of my greatest hits, and I'll talk to you about it later. But yeah, these are forms you should have, just a basic health history form. Make sure they're all filled out. HIPAA forms, got to make sure, you have all the right HIPAA forms in place, especially the Notice of Privacy Practices. And patient says, I don't want you to bill my insurance. There's a special HIPAA form. Patient says, I'm going to pay you cash in full. I don't want you to bill my insurance. There's a form for that. Patient wants to give you a testimonial. There's a form for that. Patient says, I want you to send I'm moving to Texas. I want you to send my records. I found a great chiropractor in Austin. Can you send my records to him or her? Yeah, there's a form, a special HIPAA form for that. Training log forms, employee acknowledgement forms. A lot of forms. have nice forms. Yeah, this is a notice of private. This is the form that every new patient should be filling out in your office. Notice of privacy practices. Do you have one? Have you read it? This is a good one. Part of our gold membership, we have membership programs here at Target Coding where people sign up and they pay a monthly fee, and we educate them, and it includes a total forms review. Every single form you have in your practice we'll review. And some of our, clients go, Marty, and the staff members go, is there a way we could cut down on the amount of forms we give patients? Some of our patients are complaining too many forms. Yeah, we'll do a forms review. We can do that if you'd like. We offer a forms review package. It's $3.95, so we could send us all your forms. We'll do a total scrubbing of your forms. And so we've created a lot of forms, and I've put together 75 of the best forms. So you want to get all the forms out of the way. Here's the HIPAA form. If anybody would like a copy of our HIPAA form. Oh, back to the forms review. So this doctor sends me his forms to review. I'm reading his HIPAA form. I guess he never read it. I guess his staff never read it. I guess his patients aren't reading his forms. I guess I was the first person to ever read his HIPAA form, because there was a lot of dental information in his HIPAA form, and my client is a chiropractor. I said, Doc, there's a lot of HIPAA dental information in your new patient HIPAA form. What is this? He's like, oh, my brother-in-law's a dentist. I just took his. What? You're just taking other people's forms? Read your forms. Now, if the patient doesn't want to read it, that's okay. You ever rent a car? They hand you that 14-page document. I don't read it. I just sign it. You want to read it, fine. I could tell you that I'm sure the Avis attorneys have read that agreement, and they know exactly what's in there. So you should know exactly what's in all of your forms. If the patient doesn't want to read it, that's okay. They just want to sign the bottom. Just get that signature. So this is our HIPAA form. If anybody would like a copy of it, send an email to amy@targetcoding.com, amy@targetcoding.com. We'll send you our HIPAA form. This is the form. Again, another thing I read when I do a forms review, it says, we will give you a copy of our HIPAA notice. Really? You don't have to give them a copy. You could offer to give them a copy. So, while we're talking about HIPAA, just to let you know, creating a billing and coding compliance manual has nothing to do with HIPAA. HIPAA is about protecting patient health information like their credit card, their names, their addresses, making sure you have antivirus software, making sure people log in properly, making sure you have security on your system. That's what HIPAA is about. HIPAA has nothing to do with billing and coding. So the main purpose is to protect patient information. HIPAA applies to all covered entities. Chiropractors are considered covered entities. Now, I know some of you might go, really? I have to abide by HIPAA? I'm an all-cash practice, or I use a billing company. I don't do any billing, or everything's in the cloud, or I'm all PI. I don't even have a computer. I don't have any employees. I write all my notes. Do you have to be HIPAA compliant in that case? Maybe not. Contact us for a free consultation. We'll let you know. Maybe you don't. Maybe you're not considered a covered entity. I could tell you, been doing this a while, 99% of you are considered covered entities. But yeah, we do have a few clients that are, quote unquote, off the grid with their practice. So maybe you don't have to abide by HIPAA. But if you do and you don't have a HIPAA program, start with this website. It's an excellent place to try to start doing it on your own. You need to do a security risk assessment. That's if you ever get pulled over by the HIPAA police, one of the first questions they're going to ask is, could we see your security risk assessment or your security risk analysis? So you're supposed to do one. I'd say 95% of you are not doing it. It's like having a house without homeowners insurance. You get a flood, a fire, an earthquake, whatever, a hurricane, you don't have homeowners insurance? Wow. You get HIPAA violation and you don't have a HIPAA policy in place, you could be fined thousands and thousands of dollars. That's how the federal government makes money, by the way. Those fines and penalties that HIPAA, like I have a doctor, he's being accused of not collecting the copays and deductibles. So he's wondering, well, what are they going to do to me? What could they do to me? They're going to ask me for the money back? That's what, his approach is, well, insurance companies, they're just looking for money. They want money back. Wait a second. They're not going to want money back for services that were medically necessary and you provided properly. They're not going to want the money back for that. The insurance company is going to report you to the state attorney general's office, and then they're going to come in and they're going to fine you. And that's how they make money. That's how the federal government and state officials make money, on fines and penalties. You think, when the police give out tickets for speeding and going through red lights and stop signs, that's income. They want income. So fining you for HIPAA violations or billing violations is a way for them to make money. So with HIPAA, just get all your forms signed, do a security risk analysis, also create policies and procedures, have formal staff trainings, and log them into your manuals. All right, so just a few things before we get to questions and answers. I have a little 9-step action plan I want to share with you. Step 1, get proactive. Actually, this entire presentation was about getting proactive. Step 2, staff members, this is for you. When a new patient comes in, before you let this new patient see the doctor, make sure all the forms are completely filled out. Dealing with doctors that are audited, about 20% of the doctors that we work with are in a crisis. They're being audited. They're being asked for money back. 80% of the doctors we work with in a proactive fashion. So the 20% in the crisis, this is one thing. I'm working on a doc right now. He has a nurse practitioner, and the nurse practitioner is prescribing TENS and back braces on patients, and I'm looking at the forms that the patient fills out. It says, how long have you had the problem? The patient is not filling that out. That's one of the most important questions for a patient to answer. How long have you had the problem? If it's not answered, the insurance company could say, oh, for back braces and TENS machines and certain devices, the patient has to have chronic pain. What's chronic pain? At least 3 months. If you don't describe how long has the patient had the problem? Oh, we don't know. We don't know if it was 3 days, 3 months, or 3 years. What? So get all the forms filled out. And step 3 is for the doctors. Review all the paperwork prior to going in and talking to the patient. You never know what they may have checked on the review of systems form. Step 4, review the policies from the insurance companies, especially the ones that you bill the most. Step 5, understand the what and the why. Your CPT codes are what you're doing, and your diagnosis codes are why you're doing them, and they're supposed to pair, combine, match, link. A lot of words for the same thing. And I compare it to, have any of you ever been to a food and wine festival? I love going to food and wine festivals. I love learning from the experts on how to pair your food and your wine for that maximum culinary experience. Well, you should be combining your diagnosis codes and CPT codes. For example, patient comes in with cervical radiculopathy. That pairs beautifully with mechanical traction. Patient comes in with myofascial pain in the cervical region. Well, that pairs fantastically well with myofascial release, 97140, you see? So I consider myself a coding sommelier. It's a French word. I don't even know if I'm pronouncing it right. Sommelier. Sommelier is a wine expert, a master, has gone to training to teach people about wine and food. Well, I consider myself a coding sommelier. I'm going to pair your CPT codes and your diagnosis codes, and I wrote a book on it. Patient comes in with shoulder stiffness. Oh, wow. We're going to go with a beautiful 97110 therapeutic exercises. All right, next, do a self-test on your SOAP notes. Number 6. Number 7, always keep learning. Be a sponge. You should always be learning how to help more patients and improve your business. Step 8, I just went through this, put together a simple policy manual. Step 9, regular staff trainings, especially with the staff members that do your billing, and especially on the insurance companies that pay you the most money. I call it the 35% rule. Take a look at how much money you bring in. How much of it is 35% of it from one insurance company? Do a deep dive. If the answer is yes, do a deep dive. I mentioned earlier, I have one client, he has an office. I mean, I don't know if he strategically did this. He has an office right next to a building with 300 employees, Bank of America employees. They all have good insurance. They're all coming into his practice. He has tons of these patients coming in. He's right next to this building. He's collecting a lot of money on these Aetna patients. So, got to put together a policy manual just on how he's billing. You have a billing company doing your billing, do a spot check. Make sure that they're billing out properly. I have, let's see, how many, I think I have 3 cases presently I'm working with right now, doctors who's the billing company were adding modifiers. One company was adding the 59 modifier on all the codes because the company is like, oh yeah, that's how you get paid better. Doctor didn't even know that the billing company was doing it. All of a sudden gets a request for records, is put on a prepayment audit, didn't even know why. It's the billing company. So this is all proactive stuff. You want to do this so you could SWAN. See that acronym? It's my favorite acronym. SWAN. It means sleep well at night. All right, just a few closing comments. Check with the carriers prior to submitting claims. Make sure it's compliant. Thank you for attending, everyone. Here's my contact information. Feel free to set up a free consultation. 15 minutes. Pick my brain, ask questions. Tell me about your practice. I'm doing one later. Client, Dr. Kotler, I need to talk to you. I have a staff member telling me we haven't been paid by one insurance company for 9 months. Can you help? Wow, that's my next phone consultation later today. 9 months? You haven't been paid? Yeah, you better, speak to me. So you may have a specific problem, or you just may want to just ask me some general questions about your practice. Set it up. Send us an email. We're on all social media platforms. Please follow us on Instagram, Twitter, like us on Facebook. Definitely check out our YouTube channel. So hopefully you learned something today. Oh, besides these webinars, we offer many types of services at Target Coding. We also do live seminars. We have membership programs. We sell products and videos. This is the book I was referring to earlier. If you want to learn how to pick the codes that pay the most visits, this book's for you. You want to know how to code pair, like food and wine, this book is for you. You want to know the ortho neuro chiro test to support some of the most common chiropractic diagnosis codes? Then this book is for you. For example, you ever diagnose a patient with cervical radiculopathy, M54.12 and you're questioned? How did you come up with that? You better have a good answer, like, well, we did a little foraminal compression, we checked reflexes, there was some myotomal weakness, there was pain down the arm, there was restricted motion. So, we have these ortho neuro chiro tests for about 25 of the most common. Oh yeah, here's an excerpt. So yeah, patient comes in with cervical sprain. What ortho test should you do? Cervical brachial syndrome. Yeah, do a little Wrights-Adson's. Sacroiliac joint problem, definitely do Yeoman's Ganslins. So the book has some great stuff in it. This is pairing your codes, the codes that pay for the most visits, cheat sheets, quick cheat sheet guides. Oh, I mentioned my forms. Yeah, here are my forms. 75 chiropractic, physical therapy, acupuncture, Medicare, and HIPAA forms, logs, templates, and we break them down into certain categories like new patient forms and financial and admin forms, exams and treatment plans, a whole bunch of sample soap notes. These are all in Microsoft Word. Just copy and paste them. At the top of every form, it says Main Street Health and Wellness. Just delete that and put your letterhead on top. A whole bunch of letters of medical necessity. Do you supply orthotics, back braces, pillows, cervical collars? Stand-up desk, yeah. client of mine said, Marty, I have a patient that needs a letter of medical necessity for a Varidesk, those stand-up desks. My patient said, if I put together a letter of medical necessity, the company or the insurance company will pay for it. So I put together a letter of medical necessity, got paid. Fantastic. So I added that to the book. Fight back letters. You ever get denied for an adjustment and a re-exam on the same day? Buy these forms, you'll see. You ever get denied for chiropractic adjustment and 97140 on the same day? I have an excellent fight back letter for that. A whole bunch of HIPAA forms and Medicare forms. Compliance manuals. HIPAA programs. Our HIPAA program includes billing and coding. Billing and coding manual does not include HIPAA, but with our HIPAA manual, it includes billing and coding, and it's based on how many employees. We have some clients that don't have any employees. Our largest client has 122 employees. We have clients wide range. We have some clients making $50,000 a year. My biggest client makes $25 million a year. So the programs are designed differently depending upon the practice. We also offer memberships. You want to sign up and be a member of Target Coding and attend all these webinars for free? This one's free, but most of the ones that we do are paid for. So this basic membership is $99 a month, pay as you go, no contract. You could attend all of our paid webinars for free. It's included with the membership. Just did a acupuncture compliance manual for a doc. It's helping mitigate fines and penalties. We have 11 videos that we sell. If you go to targetcoding.com, you'll see all of our videos. 11 videos. They're all up to date. So again, I want to thank everybody for attending. I hope you learned a lot. Let's go and take a look at the questions and answers that have come in.